Howdy, folks. I want to welcome you to yet another wonderful and enlightening episode of TwoX Labs. Today, we have a special guest and a wonderful friend of mine, Dr. Adrienne Rowland, who will be sharing their wealth of knowledge and experience in providing compassionate and comprehensive care to transgender and gender diverse folks, especially those who are assigned female at birth or AFAB. Dr. Rowland, thank you for joining me today. But I also want to say, I might slip and call you Age because Dr. Rowland and I have known each other since our doing our dissertations together. We went to the same program and we're buddies. We talk almost daily. So, y'all might get a little peek into our friendship during this interview. Thank you for being here, my friend.
You are so welcome. Thank you so much for having me, and that's totally fine. I'm pretty laid back, so if you do, that's totally cool. Before we get started, I really would like to take just a quick second and sort of position myself in this space.
Yes, please. Yes, please.
So I am a cisgender heterosexual female, which means that my sex assigned at birth aligns with my felt sense, and I am primarily attracted to men. I am married to a man. And so one might ask the question, so who are you to provide gender affirming care or anything, quote, queer or LGBTQ? And that's a very valid question. And so it's really important for me to be able to let people know that I'm not the expert on this topic. Mm-hmm. Every individual person who identifies in this community or is part of this community, you are your own expert. What qualifies me is the work that I have done to understand this community, to hear this people, the voices of this community, to learn from this community, to challenge my own kind of assumptions and biases and things. So I would consider myself to be an incredibly fierce ally. I have in my, well, do you want me to go into my why?
Yes, I do. I think that's
okay.
That's incredible. I think it's incredibly important in this point where, yes, both of us are cis women. I am not a heterosexual female. I'm bisexual, but having an understanding that where you are in your training helps. It gives you a very specific lens in which to the transgender and gender diverse community.
Mm-hmm. And I think my personal experience lends to that as well. I got into sex therapy 7 to 8 years ago, because I left an organization where I could not talk about anything other than heterosexual married sex. So it was very limited, and it was, I mean, just so limited. And I have personal experience of very important family members in my life who were gay, and growing up, I was never able to have those conversations. I was never able to talk about it with those people, my dad being one of them. And he actually died of AIDS at the height of the AIDS crisis, and we never had a conversation. And so this is me giving back and kind of like, this is my healing, in that as well. And me wanting to say, like, I don't want anyone to feel like they have to be silenced at all in in these conversations. And most of my friends are queer. In fact, most of my close friends to some degree are genderqueer. And so it really behooves me to understand and to be able to support the people that I call family, right? So that's why I do what I do.
Absolutely. I think you are telling not only your own story, but I am sure that there are many cis, queer, but also cis and heterosexual therapists out there who feel this imposter syndrome when you want to do gender affirming care. I do gender affirming care as well in my practice. And there is a sense of having to confront your own biases, but also that imposter to be, whether you belong to the community or not, of how do I provide care if I'm not trans, if I'm not gender fluid? How do I provide care? And I think you encapsulated it beautifully, that the training is what allows good care, but also this background of experience in your own life.
Mm-hmm. And my willingness to listen and to be humble and to not
Yeah.
position myself as the expert, right? And say, oh, no, that's not your experience. This is your experience. No, I'm hearing you, right? And I learn so much from my clients. I don't expect them to be my main teacher. And we can talk about that, about how we might slip in that way. But that willingness to say, I don't have all the answers, but I have tremendous compassion for you. And I have a fervent belief that you deserve to exist and you deserve equality and you deserve respect. And it is that social justice piece that is so important.
Yes. You are human, therefore valid.
Absolutely.
So I think this would be a really great time for us to talk about terminology and key concepts. I kind of want you to set the stage for us. Can you give us some definitions of key terms within gender affirming care, such as transgender, gender diverse, maybe gender fluid, and AFAB? And why is it important for healthcare providers, therapists, psychologists, psychiatrists, OBGYNs to understand these identities in the context of healthcare access?
Yeah. And the receptionists and the billers and the intake coordinators and the nurses and the nurse practitioners and the techs and all of it, right? Yes. So basically, most current research from Pew Research demonstrates that about 1.6% of the US population identifies somewhere in the transgender umbrella. So that could mean what transgender is someone who their felt sense does not align with what they were assigned at birth. And we have to be really mindful that gender is a construct. It is a social construct. A baby is born, a doctor looks at genitals, and for the most part is able to say or determines boy or girl. And about 1.6% of the population says, nope, that's not right. That is not what my felt sense says. So, and there's a spectrum. So someone can say like 100% that is absolutely not me. And that may be transgender. Someone may say, it doesn't quite fit, or there's some fluidity in that where sometimes I align, sometimes I don't. Sometimes it makes sense, sometimes it doesn't. And that could be more gender fluid. Gender, maybe somebody says like, forget the gender spectrum whatsoever. Like I reject it all. None of that fits. And I don't have a gender. I'm a human. I'm just me. Right. Some people say like, it's a little bit broader than that. So they may identify as gender queer. Some people say, and whether or not they call themselves transgender is completely a personal decision. And so it's really so very important to hear individually from the person, tell me about yourself. Who are you? And I will respect that. We'll talk about, best practices and respect and things like that. So non-binary is someone who, and it can vary. It may say, like some days I feel more feminine, some days I present more masculine. Maybe it's not, it could be just like however I'm feeling today, but it could be more of a like, I don't really fit like either one. And so I'm just sort of like, sometimes I'm left of center, right of center, things like that. So it really, truly is a personal experience. AFAB is assigned female at birth. AMAB would be assigned male at birth. And that really is just a designation of what a doctor said when they looked at your genitals and put on your birth certificate. So sometimes that aligns, sometimes it does not. But it's the use of AFAB and AMAB is more inclusive than, saying male or female because of the construct, if that makes sense. It was interesting because when I was doing the most recent kind of lookup of what percentage of the U.S. identifies as trans or non-binary, 5% of adults under the age of 30 are saying like, yeah, this binary, this either male or female is just it's not where I'm at. And there are several reasons for that. One is we have language, right? It's not because there were never trans people before and now there are. There have been transgender and gender diverse people for the existence of people. But now we have more
in childhood
language.
development, it's so common. It's so common to have a child express lots of different kinds of gender
Mhm.
while they're developing.
Mhm.
I
Mhm.
I was the kid that was known as the tomboy.
Mhm.
No, I
Same.
am not trans, but it was those whatever that very narrow box
Right.
that was a lot of that pink and blue stuff was marketed to us, y'all. It was
Yes.
marketed.
Yes. Yeah, it was the very gendered expectations you kind
Exactly.
of bucked against, right? And you're like, "No,
Exactly.
I can play ball, I can play with trucks, I can
Hmm.
get rough and tumble dirty and all of that." Yeah, absolutely. So I think now we have more language. Like people, so many
Yeah.
of my clients, most of my clients growing up, especially my older clients, say, I didn't have a word for what I felt.
Yes.
I just knew I felt different. And then when they heard somebody say the word trans or transgender or non-binary, like a light bulb, they're like, that's it. So we have more language, we
Hmm.
have more acceptance, even though we're struggling because there are so many, there's some 600 anti-LGBT bills circulating the House and
Hmm.
lawmakers and things like that in the country. Even with that, we have so much more acceptance now than we have in the past. So people are feeling safer and more comfortable, especially the younger folks. Like I said, people under
Yes.
30, there is more general acceptance of like, cool, you don't subscribe to a binary, it's antiquated.
Yeah.
So it's very, very hopeful in that.
I mean the very real experience of as the babies come up, they're much more able to be able to say like, oh, I have this language and I can do this
Hmm.
exploration, but a lot of times their parents never got permission to do that, and so they
Right.
respond to them with fear and
Hmm.
judgment. They
Hmm.
respond to them maybe the same way their parents, their family, their caregivers had maybe responded to them when they were young, when they were
Hmm.
doing typical exploration of who they were as a child developing. and
Hmm.
and it in this year, as we record this, we are in election year. And we're recording during a very interesting time. Over the weekend, Joe Biden decided that he is no longer running for president. So the threat of like having laws uh, enacted across the United States and across the world, let's be very, very clear.
Hmm.
What was it, 4 months ago when the Cass report came out? 5 months ago when the Cass report came out, and it is this essentially a report that in the UK that is full of unsubstantiated claims about transgender youth.
Hmm.
And
Hmm.
that's a whole nother show. Adrienne's training is 20 hours. It's over
Hmm.
20 hours.
Hmm.
We're just doing an hour together today. We could
Yeah.
do deep dives on every single part of this. But
Yeah.
I just hear you kind of describing, yes, we have more acceptance, we have more language, but the threat is very real.
Yeah. And let's, be very clear. The threat is so much more significant for Black and brown folks,
Yes.
especially, I mean, we're primarily talking about AFAB transgender people, but also the threat to BIPOC AMAB transgender
Mm-hmm.
people. I mean, the murder rate is incredible. It's
Yes.
so one thing, like it is a tad easier for an AFAB person to get acceptance and to navigate a world as a trans mask. So somebody who is, more masculine presenting, because there is a difference between gender identity and gender expression. And I mean,
Yes.
again, like you said, my training was 24 hours long. This is fairly nuanced, right? But
Yes.
how someone expresses their gender, um, and their felt sense, I use that word a lot, can
Mm-hmm.
can definitely vary, but for those who are AFAB and express their gender more masculine, it's easier because of toxic masculinity, because of misogyny, because of
Yes.
socialization. And so the, AMAB folks who present their gender identity more feminine, especially if they're Black or brown, really, really struggle. But there are systemic struggles, or there are universal struggles for trans folks
I mean,
as
you're
well.
you're leading us in beautifully. I want to talk about some of the specific health disparities and access issues that AFAB individuals face due to bias, stereotypes, discrimination, stigma, prejudice, and lack of provider knowledge. You've already started about if a person is BIPOC and how much more the struggle. Let me be clear, and I think that you this is what you intended when you were talking about it, is that the struggle isn't inside of themselves about their gender.
Right.
It's the struggle with society, and it's the
Sure.
danger that they can absolutely face that is more increased because of the multiple amount. I can't even measure the level of misinformation that people hear on a regular basis about transgender people and BIPOC people on a regular basis.
Yeah, I'm really glad that you mentioned that, because that is what I'm talking about. So the health disparities that trans and gender diverse people, I'll probably just simplify it to trans, but again, remembering it is a whole umbrella of people. The health disparities are not because they are trans, it is because of society's response to them. So even looking at, when we look at the DSM-5, which is the diagnostic manual for mental health professionals, and medical professionals, gender dysphoria is a quote disorder in the diagnostic manual, not because there is something flawed or problematic or wrong about someone's felt sense being different than their assigned sex at birth, but because of the health disparities and because of the stigma that they experience and the societal pressures that they experience that can cause harm, that can cause suicidal ideation, that causes depression and anxiety, that causes body dysphoria, and all of those kinds of things. It's because of how society treats them. So if you have a society where being gender nonconforming is accepted, celebrated, understood, normalized, health disparities and mental health issues greatly decrease. That's not quite where we are in this country. So currently, the suicide attempt rate for transgender people is 40%. 40% gives me chills every time to say it, because that is astronomical. It is so high. And one of the most protective factors for folks is a strong community and is family acceptance and care. And we're going to talk, again about like how to be that. But what trans and gender nonconforming folks experience in their medical and mental health fields is that lack of provider knowledge. Medical providers, so medical doctors, when they're going through school, they get 5 hours of LGBTQ training. I mean, if you just want to say LGBTQ, that's an hour per letter, which that doesn't even, encompass that.
It doesn't even include all the letters.
It doesn't even include all the letters, and it is not integrated. So queer care is not integrated. It is an adjunct to, and it is just as an aside. And so there is part of the research for doing my doctoral project for the Gender-Affirming Care program was why do providers struggle so much to be able to feel confident in seeing trans and gender nonconforming people? Because they didn't have the training. They don't know how. And so they're afraid. They have their biases. They have their stereotypes. They don't know what they don't know. And so even if they are well-meaning, they're still causing harm because they're not specifically trained how to adequately care for trans and gender diverse people, because it's not the same. There are some very specialized considerations that are needed. So just some of the health disparities, some of the social determinants of health that trans and gender nonconforming folks experience. There are higher incarceration rates, higher poverty rates, higher rates of housing discrimination, housing issues. So they have less housing options. They experience higher mental health issues than cisgender LGBT or cisgender queer folks. So income tends to be lower, access to healthcare tends to be lower. It's all of that. And it's worse in every category for BIPOC folks. So access to care is a significant barrier because, again, not everyone, not many are gender affirming or take the time to learn how to be gender affirming. So the fact that sorry, I just lost my place. Trans and gender nonconforming folks often delay medical care, seeking medical care or seeking mental health out of fear of discrimination or being treated poorly, because research shows that about 2/3 of people who identify as transgender or gender diverse, they have had a negative experience in a medical or mental health setting. They've been discriminated against, they've been refused care, they've been told they are wrong for who they are, they've been, conversion therapy, they've been tried to, people have tried to change them. And so a lot of times they're like, I'm just not going to go. And so then their health decreases because they're not doing preventative care, they're not getting their needs, their health care and mental health care needs met.
Yes. I think you are showing again and again the exponential building of essentially barrier upon barrier. So the first barrier is AFAB access to healthcare generally. What you're describing that happens to all transgender people at some point or another is also happening for all AFAB people, regardless if they're cis or not. And so you're showing again and again that these barriers just pile. And so the outcomes for the gender diverse population, of course they don't want to engage with healthcare. Of course they don't want to engage in therapy. Of course they don't want to, because the mountain to cross is so great. It is such a high bar to cross.
And what happens also because of lack of knowledge is that they go in expecting the expert, the medical doctor or the mental health professional, to be able to treat them, and they don't know how, so they say, teach me. So they end up, and that's part of the harm, they end up having to teach them, the professional, what they need. And that's not how it goes. We don't expect any other person to go into a medical or mental health professional, could you imagine going to a mental health professional and saying, I've been diagnosed with bipolar, and they say, tell me what that is. Tell me what that, tell me how what's the best practice for that? Or to go to a medical doctor and say, I have a heart murmur, and the doctor says, interesting, what is that? What meds do you use for that? But we expect it for the trans community.
We absolutely do. We absolutely do. I'm curious, when you have, we're going to talk about best practices here. When you have been with medical professionals, because I know that you have trained many a medical professional on gender affirming care, what are some of the responses once they have the knowledge? What have you seen? Have you seen shifts? Have you seen things that give you hope? Let's be real. This is what this question's about.
Yeah, absolutely. And there is hope, right? So, research clearly shows that when people are able to live their truth and express themselves in their gender identity, and when they are able to have the affirming care that they want, that makes sense for them. Again, it's not across the board. People who I just lost the word. What do they do when they transition? When people transition, it looks different for everybody. So there's not a set, you do this, then this, and then this, and this is how it looks for everybody. So whether people decide to transition socially or medically or legally, research clearly shows when they are given the gender affirming care that they need and that works for them, whether it's hormones or surgery or voice lessons or facial feminization, we can go into all of those things. Again, it's whole nother thing. They do better.
24 hours worth.
24 hours worth. They do better. They feel better. Depression and anxiety anecdotally goes down. When they take, hormones, sex gets better. We haven't even talked about that. That's a whole section, right? And so, so there is hope when people are allowed to express themselves in the way that makes sense for them and transition in a way that works for them. They do better. So when I train people and I give these statistics and I kind of, I do the doom and gloom that I don't apologize for because it's real, and
Mm-hmm.
talk about like what an incredible difference using a name, using a pronoun, like what a profound difference that makes and how it really isn't that hard and how you don't have to be afraid. It really does open up space for them because I think so much of it is, especially for well-meaning people, like the people who are they have their own, stuff, whatever, wherever that's coming from, and they're just anti, we're not going to help them so much, right? We can talk to her
Mm-hmm.
blue in the face. So I really target the well-meaning people, the people who want to learn and want to understand and want to know the impact of their actions. When I'm
Mm-hmm.
able to say it's so small, but when you are vigilant about learning and checking your bias and honoring their name and their pronoun, you make a world of difference for them. That gives me hope,
Absolutely.
right?
Absolutely. The you can see how people who are really truly wanting the knowledge but have never had access to it.
Right.
I teach bachelor's level students, and we do a section in my helping skills class about my fellow LGBTQ community, and some of the things that they say like, I wish I would have learned any of this
Mm-hmm.
earlier in my education, because most of them are seniors and
Mm-hmm.
none of them have ever had anybody go, okay, if you're going to go into the helping fields, you need to understand it does not
Yeah.
matter what faith background you ascribe yourself to. You are going to likely interact with somebody who is queer or somebody who is trans, and you should at least have access to the basics of the knowledge.
Absolutely.
So I'm just so glad that you exist. I mean, you know that generally as my one of my besties, but this is incredibly important for therapists, psychologists, for the frontline staff, the staff who is at the front
Mm-hmm.
desk, to
Mm-hmm.
learn how to help. Because
Mm-hmm.
most people, regardless of what hate the media really wants to spend its time on, most people, especially in the helping fields, want to.
Yeah. And research shows that it's lack of provider knowledge, not necessarily bias, that causes harm, right?
Yes.
And so the very, very first thing I would say, I don't know if you're ready for maybe some interventions, but the
I
very, very
mean, let's
first
go
thing
into
I would
best
say,
practices. Let's do it.
yeah, yeah, would be to not make assumptions. So we have to challenge this cisgenderism and heteronormativity. Cisgenderism is
Yes.
the belief that everyone is cisgender, that
Mm-hmm.
is the quote norm, that is the standard. Heteronormativity is the same thing, is that you are straight and cisgender until told otherwise, right? And then the other is uh, an anomaly kind of thing. We need to normalize that every human is different and come into
Yes.
every single situation with a blank slate and have no idea. I don't know. I cannot look at a person. I genuinely cannot look at a person and know their gender identity because, like I said
Right.
before, gender identity and gender expression may be very different. And so, what
Mm-hmm.
I really encourage people to do as a best practice is to be very mindful of gendered language and eliminate
Mm-hmm.
it from their
Yes.
vocabulary. And it's not that hard to do. I mean, we're not talking about climbing mountains here. We're talking about saying
Yeah.
folks instead of ladies and gentlemen. We're talking about
Yeah.
saying, um, the doctor is ready to see you now, as opposed to the doctor is ready to see you now, ma'am. We just
Right.
eliminate the gendered language. We don't make assumptions, and we have the
Mm-hmm.
courage to ask, what is your name?
Yes.
What are your pronouns? And I can demonstrate that by displaying mine. I am
Yes.
cisgender, and every signature that I have, my email, my Zoom, my whatever, has my pronouns because
Yeah.
I want to let people know that I'm not making assumptions and I am being inclusive. And I am,
Yes.
um, and I have people ask me, what are your pronouns? And I don't get offended like, oh, how could you not tell? Right? Because that's ridiculous. It's not about proving something. It's not about quote passing. That's again a whole nother thing. And I'll plug a book at the end. Don't let me forget. That
Yeah.
that
We'll
has a
definitely
great
talk some
example of
books,
that. Yeah.
because we have some books to offer
Yeah.
up.
Yeah. So just being mindful of gendered language and practicing it in your everyday life, like just being aware of it, just noticing when you hear it, noticing when you say it. And it's not about being perfect. That's the other thing. You are going to make mistakes. It is
Yes.
100% okay. The most important thing to do is acknowledge it, apologize, and move on. Do not
Yeah.
make it the other person's problem. Do not make it the trans or the gender diverse person's job to make you feel better about,
Yes.
making a mistake. So if you misgender somebody and they correct you or you catch yourself like, oh, I'm so sorry, correct yourself and move on. And
Yes.
you may encounter a transgender person who gets really offended and
Hmm.
really upset. And that is really important for you not to take personally because you have
Hmm.
no idea how many times they have been misgendered that day, and that may be the last straw. Because when
Right.
we talk about the compounding microaggressions or lack of intentionality, lack of willingness to do our own work and be mindful, the incredible impact that that has on the trans or gender diverse person that they carry with them every single day. And
Absolutely. You're
so,
you're just
yeah.
describing so deeply the the experience of having been misgendered all day, but I don't want to run past how you talked about how to handle that and how to
Mhm.
not put the responsibility on the person that's in front of you
Mhm.
to fix it.
Mhm.
You did not, you described the apology. Hey, my bad. You fix the pronouns, you move on.
Mhm.
You didn't fall all over yourself. You didn't like make it about your own emotions when you do that.
Right.
And I think I think our listeners, it's helpful to understand like, oh, this is how I do this. This is
Yeah.
how I respond.
Mhm.
Because like you were saying, the well-meaning are are wanting to know how to do this and care for people well. And also this is where the errors happen.
Mhm.
When somebody's well-meaning and then they want
Yeah.
to make it right and then they make it about their own emotions.
Yeah, and it's so important not to and to not fear, like even if somebody gets mad, recognizing that's their experience, that's their stuff, and you can be very sincere in your apology. Like, I am so sorry. Like, it was not my intention to offend you. I'm working on this. And I am gonna do better. Like, I will want I when I know better, I do better, and that's your commitment. And that is requires practice. So if you have a new client or a new patient or something and you're struggling with, oh my gosh, I keep misgendering them, go home and practice. Talk to
Yes.
your colleagues when you talk about that person. Absolutely 100% of the time use their pronouns, right? And a lot of times people say preferred pronouns, and I just want to clarify, it's not a preference.
Mm-hmm.
My pronouns, she, her, hers, is not a preference. They're mine. That's who I am. Those are my pronouns. So
Yes.
if you are used to saying like what are your preferred pronouns, just drop the preferred. It's not a preference. What is, if somebody has chosen a different name than their legal name, it is their chosen name, right? Um, just what is your name? What's your chosen name? Is if that's different.
Mm-hmm.
That's why it's so important that agencies and medical centers and all the people have accurate SOGI collecting information, so sex or sexual orientation, gender identity information, and that they use that two-step method where they get assigned sex at birth. They need to know that because there are certain health screenings that are necessary. We need to
Mm-hmm.
know about person's body, right?
Yes.
When it's valid, when it's necessary. It's none of our business when it's not. Um, and then we also need to know gender identity. And if that's different, we
Mm-hmm.
need to make sure that it is noted in every possible way throughout the medical
Mm-hmm.
record, throughout the electronic medical
Yes.
record. Sorry, I kind of jumped around a little bit there, but I felt like that was
No,
important
you're
to say too.
yeah, I think it is important because we're talking about best practice. You're talking
Hmm.
about how documentation can be
Hmm.
incredibly helpful and aid you in being able to support this person as much as you possibly can. Because and I will absolutely talk about like the times in sessions where I have made errors, because I have patients right now who are on their gender journey and trying to figure out which pronouns fit for them right now as they're going through it. And so we're in a place where we might be switching pronouns per session as that person might need. And so I just accept in my side myself, I'm gonna fuck it up. And I can't make it about me.
Yeah. Yeah. Absolutely.
And I apologize and I switch my gears. But every session when that person needs it, we check in about pronouns because that's what they need. Yeah. And that's okay. It's okay that our patients need that.
Absolutely. Yeah. And then that's respect. And that is self-determination and autonomy. And that is you letting your client be the expert of themselves and telling you who they are, right? That's not you making some preconceived idea of what that should be, right? And if you don't have systems in place yet and you're working on them and you don't have a mechanism to have, pronouns on every aspect of like the medical record or whatever, and you make a mistake, you can say, you know what, we're working on this and truly mean it. Like this, I made this mistake. I'm really sorry. We're working on updating our system so that doesn't happen again. But you've got to be willing to take the responsibility and say, I'm doing the work, right? Yes. And not, like I mentioned a couple of times, not expecting your trans patient or client to teach you about themselves. That is different than tell me about your experience that may be unique, right? But it's so important that they not come to you and say, I'm trans, and you say, oh, what's that? Like you need to do your own work to train yourself, which is part of what this is. Again, it's a very, very small taste. But you being able to say, like, I'm going to educate myself and I'm going to stay updated. That's the other thing, is this is not a one and done. Language is always changing. Standards of care are always changing. And so staying current in what is different, what is new. It used to be that, transgender people used to be called transsexual. That is offensive now. That is outdated language. So we have to stay on top of what that means. And so seeking out those opportunities to make sure that you are able to be as competent, and then say, okay, I have this basic understanding, but I want to hear from you. What does non-binary mean to you? Because I'm not making the assumption. That's cultural humility, right? Is knowing, like, I don't know everything there is to know. What does that mean to you? Let me hear from you.
So I think you just melded those things beautifully. And also, I think to add to that best practice is the next part is taking that case to a supervisor, and to a supervisor who knows about gender affirming care. And it may not be that you have a clinical supervisor maybe you're in an agency, maybe you're in a private practice, maybe there isn't a person around you who is doing gender affirming care, because the CEU is going to be heard by people across the United States. So it is incredibly important to try to reach out to someone who does do gender affirming care to help you through your own stuff, but also help you serve these folks as well and as competently as you possibly can. And the reality is this isn't going to be the only time you hear from Dr. Adrienne, y'all. Dr. Adrienne's coming back to be able to update us, but also be able to we're going to do deep dives on all of the things that we said that we could just spend all of our time on. And so the best practice is the education of self, like absolutely evaluating your own stuff around gender, seeking consultation and or supervision, making sure that it's a systematic evaluation of gender affirming care. So from intake all the way through the clinical experience. Are we missing anything?
Probably. Very honestly, yes. I think we're probably missing a lot, right? But I think that's a really good start. And we didn't really talk a whole lot about one big aspect of my program is challenging implicit bias. And so you did mention it just then of like really being willing to say, okay, where are my biases? I mean, everyone has bias. Every single person. I have bias that I try to work through, but being aware of it is half the battle, and then being able to have either a consultation or a supervision or somebody that you trust that you can say, I'm struggling with this because of my upbringing, because of my religion, because of something I was taught or I just wasn't aware of, and really be willing to expose it in a safe place, not with the trans or non-binary person in front of you because it's not their job, it's not their work, but with somebody that knows how to help you navigate that so that you can begin to slowly challenge it and provide better care.
That's ultimately, at the end of the day, that's what this is all about, is providing better care. So how can professionals and community members advocate for the fair and equitable treatment of transgender and gender diverse folks in their practices, in their communities? What's a good beginning place for them?
Yeah. Well, it starts with yourself, right? So and to call out problematic behavior. I know that may feel like confrontation. It may feel uncomfortable, but getting comfortable telling someone who maybe makes a joke. I mean, we do this with anti-racism, and we hope to do this with anti-racism. It's interesting. Do I have time to tell a little story?
Yes.
Okay.
Absolutely.
So I just did a training for mental health professionals, and I showed a vignette about accountability, about workplace accountability. And it was in a medical setting, and these nurses were sitting around talking about a patient who was transgender, who had gotten into a car accident and needed a Foley catheter. So needed a, tube placed up into their urethra to, all that. And one person made an incredibly transphobic remark that I'm not going to repeat because it was really harmful. And they showed the example of no accountability where the other people kind of laughed and agreed and things like that because she was like, I'm not doing that. Like, nah. And so then they showed an accountability piece where the coworker, after she made that remark, said, you just violated this agency's anti-discrimination. I'm going to have to report you to your supervisor. I will take care of this patient. You can go now. And our conversation for 20 minutes after that was centered on the fact that the person who held the other person responsible or accountable was rude. When she said, you can go now, like how that was not okay, how she was rude. And I was boggled, and I was, sitting in it with them and trying to explore it with them. And I said, hold on. If that person had made a racist remark, if they had said, I'm not going to help that expletive, would you be concerned about that accountability person being rude? And it was kind of like a light bulb. And so what I truly believe is that we are giving way too much permission, not we as in you and I, but society gives way too much permission for microaggressions, for outright aggressive and disparaging and phobic remarks. And so really taking confidence in if somebody makes a joke or if they refuse to use names and pronouns, to really be able to stand up and say, that's not okay. That's not what we're here for. I'm not okay with that. And have a process, work on a process in your practice for who they can go to complain and have accountability. And have
this
a process.
This is an incredibly a big part of the best practices because I think this is an incredible necessary part of having a system in place, because you can have the great paperwork, you can have all of these things, but if someone does not have consequences for being discriminatory, then it's all going to go behind a curtain anyway.
Right. It's going to fall on deaf ears. It's going to be dismissed or trivialized or minimized. But there also needs to be a mechanism for clients or patients to be able to say, hey, I was not treated with compassion, or I was discriminated against, or I was harmed in this way, and have the system where there is someone in charge, someone appointed to provide the consequences, to provide the standard, and have that written in. So it's a top down process. You've got to get the execs and the owners and all of that on board with this is just as important as any other social justice area.
Yes,
right?
Absolutely. It absolutely is. And that is where I think these are the parts of advocacy, yes, parts of best practice, but these are the parts of advocacy I think that so often are missed because it seems like, oh, I'm systematizing my advocacy. Yeah.
Yeah, and we
You
need
are.
systems.
And
Yeah.
it needs to be included as part of the system of helping the people that you're trying to help.
Yeah, yeah. And so the call to action is get involved, right? Like
Yes.
speak up, um, center yourself in queer community spaces. Like don't be afraid to, especially if you're a cishet white person like me. Like don't be afraid to show up and say I care. I want to be. We queer people want allies. They want
Mm-hmm.
to know that we have their back because let's face it, I have privilege. I have tremendous privilege. And I want to use my privilege to help and to be supportive. And I know I come off super strong in this, and I want people to feel like they can say, like, I'm struggling because, like I said before, of what I've learned, I don't know this. Like, I have tremendous compassion for people who want to do better, but just don't know how. Like, I am not one of those people of, like, you don't know, like, you didn't clean your house before the house cleaner came. What were you thinking? Right? Like, I know people don't know what they don't know, but once you know, I am holding you to do better. But I'm not asking for perfection because I am by no way perfect, right? I can't even speak.
Exactly.
You know what I mean?
I mean,
So
none of us are going to get it right 100% of the time. It's just not
no,
possible.
and nobody expects that. They really don't. But get involved, right? Donate to the queer community, shop, BIPOC queer small business, right? Like show your support, display your pronouns. That is a huge thing that you can do, like on your name badges, in your emails, on your Zoom calls. That is letting people know that you are with them. What else did I have on here for my call to action? Talk to trans and non-binary people and ask them, what do you experience? What do you need from me? What would be helpful? What is something I can do that would help you feel seen and heard?
You are, again, decentering yourself and helping to bring forward people who deserve, at minimum, to be seen and heard. At minimum.
At minimum, yeah.
So as far as, because we're coming to the end of our time, so before we wrap this up and give you all kinds of fun books and things and other resources, do you have a few real life examples where gender affirming care made a significant difference? What are these, maybe with practical strategies our listeners can take today and start putting them into their own practices?
How to pick. Yeah. So practical strategies, especially from like a mental health standpoint, what I have really worked hard in when I've worked with trans folks is really listening to them about pacing, especially if they are in the process of coming out in different areas of their life. And so, in no way pushing or saying, I think you should tell this person or come out at work or change your name or whatever. But really walking alongside someone and saying, what are you ready for? And really processing with them, what's likely to happen? What's your worst fear? What's the worst that could happen? And if that happens, then what? And really spending time processing with someone their choices and remembering that they get to do it in a way that makes sense for them. And that, we know that when somebody comes out, they come out for life, basically. They come out in all different kinds of situations, for their life. And so not prescripting, oh, well, you need to do it with your partner and then with your extended family and then with work. And then, no, it can look like, who are your support systems? What would be safest, for you? Start with the people who are going to be your champions first, right? Because then you have that group of support around you. So, I have been working with this is actually an AMAB client, but a transgender
Mm-hmm.
female, um, for years, and it has been a very, very long process. But when she came out at work and she was able to come back to me and say, this was the experience that I had, and this was the acceptance that I received, and this was the process that we went through, that we ad nauseum went through, like checked all the boxes, right? As much as we could imagine, like as much as we could predict. I cannot tell you, it is my single best, like the thing I love the most is when one of my trans clients has a win and
Yes.
experiences authenticity in themselves in whatever way
Yes.
that looks like, whether they're showing up to session as themselves, expressing their gender in whatever way that makes sense to them, and like getting acceptance for
Mm-hmm.
that, whether they had a conversation with a friend or a partner or a coworker or whatever. And even if it didn't always go well, but just their sense of themselves makes,
Mm.
when they start hormones and start to feel like themselves, I mean,
Yes.
that is so validating. But I think being able to sit in a space with someone and say, I accept you, I
Mm-hmm.
see you, you are
Mm-hmm.
valid, and I am going to demonstrate that by using your name, using your pronouns. I'm going to ask you what you need from me, and I'm going
Mm-hmm.
to ask you how I can help you. Like, let you tell me what you need. It just makes a world of difference. It just really
Yes,
does.
absolutely. That the honoring where they are when they're there,
Hmm.
and that timeline is going to be whatever that person needs it to be.
Yep.
And I think those moments, like when you were talking about the wins for
Hmm.
your trans patients, like I for me, I had like four of them flash through my mind of these wins and what it's like for them to experience gender congruence or
Hmm.
gender euphoria, or
Hmm.
just those moments of like, yes, this is who I truly, truly am.
Hmm. Yeah.
And to get to bear witness. Because I mean,
Yeah.
ultimately, especially for us therapists, like that's our one of our primary jobs is
Hmm.
to bear witness. And when we get to
Hmm.
bear witness to somebody becoming truly themselves, it is
Hmm.
transformational as a professional, but it's
Hmm.
also incredibly moving to witness
Yeah, it's awesome.
as it happens.
Yeah. And it's also an
So we're
incredibly
coming up.
sacred. Oh, sorry. I'm sorry.
You're you finished with that sacredness. Hold on, we got
I
to
was
talk
just
about that.
I was just say it's also a very sacred space to hold the pain, right? And to sit in the pain with a client, especially a transgender non-binary client, when they
Mm,
have been discriminated against, when they have experienced harm or not being accepted, or all the things, to be able to sit with them and cry with them and be scared with them. I just had a
mm,
profoundly valuable and hard conversation with one of my trans clients about the state of the world and the fear about,
yes.
what does this mean for me? Do I have to go back into the closet? Do I have to hide who I am? Do I have to move my family to another country? I have trans clients who are
Yep.
moving out of this country within the
Yes.
next few months. It's real,
Yes.
right? So I just think
It
being
is
able to sit with
very,
them in
very
that,
real.
I hold so sacred. I'm privileged to be able to
Hmm.
to be there with them in that.
Absolutely. So
Yeah.
as we wrap up, I kind
Yep.
of want to hear some of your final thoughts. Any of those wonderful resources that you have, or
Yeah.
final advice that you have for our listeners.
Sure. A few resources. So WPATH is the World Professional Association for Transgender Health. They have a standard of care. I think it's on 8 now. Their version is on 8. It
Hmm.
tripled from 7 to 8. So it's so much more comprehensive than it's ever been. It's a wealth of knowledge. It gives very detailed expectations or standards for medical
Hmm.
and mental health, but mostly medical processes. We didn't even talk much about, how people transition, things like that. So I do recommend
Whole nother
WPATH.
hour. Like I
Whole
said,
nother.
you're coming back.
So I do recommend WPATH. The Human Rights Campaign does a really good job of providing resources. Um, LGBTQIA plus, maybe.com. I can't remember if I don't know if you're going to do show notes. I can send you some of those
Yes.
resources and you can throw those in there.
Yes. All the
Like
links will
websites
be
and
in the
things.
show
Yeah.
notes.
Okay.
Absolutely.
There are lots of good resources out there. There are toolkits and best practices and standards out there. I
Mm-hmm.
highly, highly, highly recommend Ray McDaniel's Gender Magic. It's a book.
Yeah.
Ray McDaniel is a phenomenal human being and therapist and recently wrote Gender Magic. It is so good. I highly
Yes.
recommend In Their Shoes by Jamie Windust, who is a
Mm-hmm.
non-binary model and author. It's so good. It gives such a great account of what it may mean to be non-binary.
Mm-hmm.
For professionals, especially in the sex therapy field, I recommend Trans Sex by Lucy Fielding. Um,
Yes.
and I also recommend me. So I
Correct.
do I do consultation, I do supervision. I'm very close to being able to apply to become an ASECT certified supervisor. I'm nearing my
By
end
the
of my
time this
stuff.
airs, you're going to be an ASECT supervisor. So
That might be true.
get on
Um,
the list today to get on Dr. Adrienne's list to become a supervisee. Just saying.
yes,
It's going
yeah,
to fill up.
yeah.
It's going to fill up fast.
Yeah, so I'll be providing supervision groups and I do individual consultations, I'll do individual trainings. And my specialty is partly in gender affirming care, but I definitely specialize in other aspects of sexual health. So again, with regards to AFAB people, religious trauma and desire
Mm-hmm.
discrepancy and, all the things. Um, but yeah, that's what I can think of right now.
I want to add a fictional book that I just finished. It's a murder mystery, so it's much more about like a trans teenager's experience. But it was written by Jodi Picoult with the help of another trans author, and I will put everything in the show notes because thank you, ADHD and perimenopause, for not letting me pull up names and words when I want to.
Hmm.
Um, So I'll make sure all of those are there. But the book is called Mad Honey. It is a wonderful account of a trans teenager's fears about coming out and coming out to people that they thought were friends and the consequences that often happens for trans teens and trans young people. They really do a wonderful job of explaining what the experience is like while also telling a wonderfully thrilling story. So, how do people find you in the world? How do they find you for supervision?
The best way is my email. So it's
Mm-hmm.
adriennerowland68@gmail.com, and I'm sure you'll put that in there. I'm working on my
Mm-hmm.
website, still under construction. Like talking on the phone so much, I'll just be honest. So email really, truly is
Yeah.
the best way.
Yeah, I'm the same way. I don't answer my office phone. I
Right, wrong, good or
don't
bad. I
answer it.
mean,
I tell all my patients, I'm like, yo,
yeah.
email. If
But
you're gonna get a hold of me, email me.
but if you email me, I will get back to you because it goes to my phone. I'm on it all the time. That
That's
is the
right.
best way to get a hold of me.
On between sessions, how on earth?
Yeah.
When am I gonna call a person?
Right.
This is 2024 problems. So anyway, folks, I'm so glad you stuck around to the end. And like I said, Dr. Adrienne Rowland, my words are terrible today, y'all.
You're good. You're good.
Are everything will be in the show notes. Everything will be accessible. And look for more trainings from Dr. Adrienne coming soon. And remember to check out our website, 2xlabs.org, for more information and resources. Until next time, stay informed, stay supportive of one another, and we'll see you in the next one.